Okay, we've already talked about the first three steps: the portal of entry, the binding or attaching to the host and becoming established, and then how they survive the host defenses. But now we want to look at step 4, which is where they actually start to cause disease. Um, they've entered, they've attached, and they've withstood defenses. So now they're going to cause some tissue damage, cause some disease. Um, they have these enzymes sometimes that help them with this. And these are toxins that are secreted by your bacteria, your fungi, your protozoa, and some of the worms that will break down and cause damage to the tissues of the host. And other enzymes will help to dissolve the host defense barriers. They've got examples there: the mucinase that will attack the mucous membranes, keratinase that will affect the skin and hair, and then down at the bottom you see that some of them even react with parts of the blood, and they disrupt the circulatory system because they will have coagulase, which will cause clotting in the host as well. Now, looking at these toxins, remember, a toxin is a poison that they produce that is poison to other organisms. And if you look down this list, you see toxemias there, where that toxin gets in the blood and gets spread to other sites, and they are extremely scary because they are spread, they're not localized. Botulism is an example of this one. Now here we have endotoxins. It's a toxin that is shed from the outer membrane. It's not actively secreted, but it's shed. And then exotoxin is secreted by the bacterial cells into the infected tissue. So exotoxin is secreted by the bacterial cell. Endotoxin is not. It's just shed from the outer membrane. And here you see on page 367 in 13.7 table, in the new book it's 13.8, you see the different characteristics of some of the exotoxins and endotoxins here that you'll want to look over. Now, we know that HEM means blood, and lyse is to burst. So hemolysins will cause the blood cells to lyse or burst and to release the hemoglobin. And we'll be doing some labs where we use the alpha and beta and gamma hemolytic, and we'll put it on blood auger to see if it dissolves, breaks down the blood. There are some examples of the hemolysins. Some of the streps and some of the staphs will cause this. Now, what is the process of infection and disease? Well, they have to establish themselves and they have to spread. And eventually they settle in a particular target organ, and that's where they start to cause damage and weaken the host tissues. There is a vocab term down at the bottom, necrosis, where it leads to cell tissue and death. And there on the right is a picture of necrotic tissue that has been damaged to the point of death by these microbes and the infection and the disease that they cause. We have here some vocabulary associated with the patterns of infection. First is localized infection, where the microbe enters the body but it stays in a specific tissue, like boils and warts don't usually spread all over the skin. They're just in certain areas. A systemic infection, though, will spread to other sites, usually by the bloodstream. Measles does this, chickenpox does it, and of course the HIV virus and AIDS are systemic infections. A focal infection is where the infectious agent breaks loose from the local infection and gets carried to other parts of the body. So it starts out local and then it breaks loose and becomes a focal infection. Tuberculosis is an example of this, and scarlet fever as well. Then there are mixed infections where you've got several different microbial agents that will establish themselves at an infection site at the same time. a lot of wound infections, your dental caries or cavities in your mouth, gangrene. These are all mixed infections. The primary infection is the initial infection. The secondary infection is a secondary infection that complicates the primary infection. For instance, if a child has chicken pox and they scratch the pox because it itches, then some of the staph bacteria might come in and establish itself, and that'll cause a secondary infection and make the chicken pox worse for the child. An acute infection is very severe, but it's very rapid and it doesn't last long. But a chronic infection can persist for weeks or months even. They last a very, very long time. Now here, when we look at the progression of infection, there are 5 stages: the incubation period, prodromal, invasion, convalescence, and then recovery. So if we start out with incubation, this is the time from the initial contact until the appearance of the first symptoms. Then you go into prodromal, which is a short period where the symptoms are starting to appear. You may have a headache, you may be achy all over, your stomach may hurt. Then you have the period of invasion where the infectious agent is multiplying rapidly, and so it gets well established and you feel really awful. And during this time you're probably going to go to the doctor to get some relief, but that leads to the convalescent period, which is the recovery period, where your strength and your health gradually return. You start feeling better. Now here we're looking at signs and symptoms, and they are not the same thing. They are different. A sign can be measured. It's the data or the numbers. It's objective evidence of the disease. A symptom is just a description. It's very subjective, how the patient describes how they feel. And here you have the same table in your book. You see some of the different signs: fever, chest sounds, swollen lymph nodes, abscesses, tachycardia. But your symptoms would be how you describe how you feel. You know, I'm nauseous, I itch, I have a headache, my throat hurts, those kinds of things. So you're again here, symptoms and signs. Symptoms of inflammation would be fever, pain, soreness, and swelling. You know, I have a fever, I hurt, I'm sore, this is puffy. But if you, the signs of inflammation would be edema and abscesses and lesions where you have an infected place that you can see. As far as your blood goes, signs of infection, we see the terms leukocytosis and leukopenia. That has to do with your number of white blood cells. Their septicemia is something you need to know what that is. That's where the microorganisms are multiplying in your blood, and there are a lot of them. If you're septicemic, we need to be familiar with that term. Sometimes you don't have any symptoms. You are asymptomatic, and these can be very dangerous because you can be spreading the microbial infections around. But most of your microbes do have a sign of some sort. That leads us to step 5. Now we have a portal of entry, then we attached, then we survive the host defenses, and then we cause disease. So now we've got a portal of exit where we're going to leave the host. And the exit portals mirror the entrance portals. You've got the respiratory and salivary portals, the skin, the fecal exit, the urogenital tract, and then also bleeding will also provide an exit portal